Good evening. Welcome everybody to our Facebook Live about the new patient access system for patients in Handsworth Wood and Lorry Pike. A couple of our practices, Enki and Bellevue, have already gone live with this system a couple of weeks ago, but we want to reach out to those patients at Handsworth Wood and Lorry Pike to tell them a bit more about it. My name is Lois Brown. I work for Modality Partnership, and with me today I have Dr. Naz Ahmed, who works in Birmingham. So I'm going to quite quickly hand over to Naz to do a presentation, and then once the presentation's happened, please feel free to ask questions in the chat and we will try and answer them as best we can. So off you go, Naz.
Thank you. Thanks, Lois. Hi, some of you might know me already. I'm Dr. Ahmed. I work as one of the GPs at Handsworth Wood Medical Centre. I've also done shifts at Lorry Pike Health Centre, so you may recognise me from there. I wanted to take this opportunity to present to you the new changes that are coming for our patients and our online booking service that goes live on the 15th of October. I've got a short presentation and then I'm happy to take any questions at the end. So I'm just going to share my slides now. So let me just do that. So just to let you know, obviously this is a virtual meeting, so if you do hear any fire alarms, it's your house, so please do respond accordingly. And just to let you know that this is being recorded, so if you miss any parts, you need to pop out, you need a comfort break or anything like that, please don't worry, you won't miss very much. You can always watch it later, and we will be answering all the questions at the end. So keep your comments in the chat, and we've got people looking at those to make sure that we capture all your questions. You may find that we answer it throughout the course of the presentation, but please do keep those in mind if you need them. Okay, so our new online booking system goes live on the 15th of October, which is Tuesday. And I just wanted to talk you through the reasons why we've chosen what we have and how it works for you. So we've listened to your feedback. This is some of the feedback that we have received from you guys through our national patient survey, from comments and complaints that we've had across the years, across Birmingham Modality Division. We hear you. You don't have a choice of who you want to see. The appointments that you do get don't often capture what you want or where you want to be seen. People feel rushed, no one has any time, and sometimes you are in the queue for an hour, 2 hours, and at the end of that you still don't get an appointment. We've heard this and it's difficult to hear, but we understand where you are coming from. There is huge positive appreciation for our staff. You understand that we're trying to work with what we've got, trying to help you as much as possible. And when you do get to see us, you appreciate our care. You feel it's good, sometimes excellent. But the biggest problem, is access. Trying to get to see us is the biggest difficulty. So that's why I'd like to take this opportunity to explain why we are in this situation. So this is just an example of some of the telephone data that we have that is for Handsworth Wood Medical Centre, looking at the number of calls that we received from January to April. So we have the total number of patients of about 17,000, and you can see that we get nearly 10,000 calls a month. This is a similar time scale for Lorry Pike. Again, for 15,000 patients, you get 8,000 calls a month. That's a huge volume of calls to get, to be able to deal with, to be able to manage, and to be able to point in the right direction for appointments. This is just the telephone data. This doesn't capture all that our team are doing. So they are managing the hospital requests, the letters that are coming in, prescriptions, documents, emails that are coming in from other services like the district nurses and the palliative care team. That is a huge amount of work that we're trying to do with a small number of people. And not to mention, our GPs are working really, really hard, but we're working with fewer GPs than we ever have. And that's a national problem. So what can we do? So, as I said, the level of phone traffic has a huge impact on our staff. Our staff are proud to belong to the NHS and they want to do the right thing for our patients, but they're under a huge amount of pressure, as you can see. But we also want to listen to the feedback that we've got. We want to be able to offer better access to our patients. Part of our contract with the NHS is that we need to provide online access, which some of you have used using the NHS app and the online booking, but it is limited. So we thought that maybe we could find a smarter solution that would help both our patients and our staff, and that was really important to us. So, having listened to your feedback, that 8 a.m. rush, if you need to ring at 8 o'clock in the morning to get an appointment that day, and sometimes by 10 past 8, those appointments have gone. That rush was causing a lot of extra stress for patients and for staff. You fed back to us that sometimes you didn't even get an appointment at the end of the queue. So we wanted to find a solution that helped you see the right person at the right time, that suited you, but also was appropriate for the concern that you had. Okay. So what did we do? So a small team of us wanted to find the right solution that worked for you and for us. And we looked at lots of different systems that are available at the moment that and other practices around the UK that are in a similar situation. We had meetings, we had some consultations to try and find a better way. Our aim was simple: to simplify our appointments booking process to give patients a safe choice. So what did we do? So we looked at a number of different options, and the one that we settled for and we partnered with is called Rapid Health. And there are several reasons why we chose Rapid Health. First and foremost, it's NHS approved. So that's really, really important to us for safety's perspective. It has all the governance and approval that allows us to use it as part of our NHS contract. It's web-based, so there's nothing to install, there's no apps, you don't need a login. And you can access it directly through the practice website, and it's actually available 24 hours a day. It enables patients to book their appointment themselves where appropriate, and it can offer patient choice of appointments and days and times and clinicians depending on the problem that you have brought to us. And again, I come back to safety. It is safe. If an appropriate appointment is not available, your request will come back to the duty GP to assess and advise. Okay. So, some of you may remember e-consults. They were really good in one way. I really enjoyed interacting with them. You could contact us at any time of the day. You could give us really important information for us to able to help you as best as possible. But the difficulty was that the doctor had to read each and every one of them and then make a decision. And some days we could get more than 200, which actually took a doctor out of doing clinical appointments to be able to go through, read them, and make sure that everybody got the right appointment at the right time. So that was a lot of people heavy, and it wasn't the most efficient service that we could provide. Some of the other systems that we looked at did a little bit more than just patients filling in a questionnaire and a doctor reading it. But the system that we chose, Rapid Health, will identify you as one of our patients using very simple information from you, really your first name, your surname, your date of birth, and your postcode, and then allows you to complete an online appointment request, asking you some questions to understand better what the problem is and how we can help you, and then goes on to offer you an appointment for that problem. So it allows you to book the appointment yourself, looking at your diary, looking at the commitments that you have already in the week, school runs, other appointments, and to be able to book an appointment that works for you and the problem that you have. Okay. So, as I said, it identifies you, it assesses the problem that's going on, it makes sure it understands how urgent this problem is, and it navigates you to a booking system so that you can book that appointment. Okay. So what do other people think about this? So it has been being used in a number of sites already. It's been going for about 5 years, and the feedback is fantastic. So most patients prefer to use this system to book their appointment. 93% of patients found the questions really easy to follow. The reading age of the questions are around the age of a 7-year-old. So most people find them manageable and easy to follow. They found that the smart triage was easy to access, and they preferred and were happy to use this to book their appointments. Okay, so how do we do it? So what you need to do is you go to our website. So this is the Handsworth Woods website, and you click on appointment information, and you click on online services, or you can click on the Rapid Health button there. And then it takes you to the next screen, which shows the very warm welcome. And you click on the medical request if you have a medical request, admin request if you have a fit note that needs updating, you've got a question, you're looking for your test results, etc. And you can also even get help for yourself for conditions that we have information on there for you. So I'm just going to show you a short video now, and I'll talk you through how it works in real time. So you've got to bear with me because it goes through it how you would. Okay. So let me see. So Laurie Pike's looks exactly the same. Lois, are you able to play the video, please? Do I need to stop sharing? Ah, brilliant, sorry. So apologies, this is for Enki. So once you've clicked on warm welcome, it asks you to basically confirm that you don't have any urgent medical issues. You click in the box to say what problem you might have. You don't have to get the spelling right. You can put back pain in, and it offers you the options that thinks it might be related to. So it could be stomach pain, but it might be muscular back pain. So you can click on select to say, actually, no, it feels like this one is the right one for me. You put in your date of birth, exactly how it is registered with us. This is a test patient, by the way. It's not a real patient, so you don't have to worry about any confidentiality, and that's why the name is a little bit silly. So again, it's really important that you type your name in exactly how it is with us. So some people I know have nicknames, or they are like to be called a different name, but make sure it's the one that we have got registered for you. Please put in your postcode, and we do need to have an email address on your record to make this work. Now, you may not have an email address, or your family member may not have an email address, and we can help you with that. If you just contact the practice, we can help organise a solution for that. Again, it doesn't need to be the email address that's registered with us. It can be an email address, but we do need one on your record. And we need a number to contact you just in case. Again, that number could be any number. This is a dummy number. Please don't ring it. And then it looks to find you, and it has found you. So then you click on, you understand that this is going to be saved to your medical record, and you click on next. And then you go through a series of questions so that we can better understand what your concern is and how it is affecting you. So you can tick all the ones that are applicable to you, where the pain is. Have you got any of the other symptoms that are going on with that? Some of these questions might seem a little bit strange, but honestly, they are the questions that I would be asking you to understand better what your pain is. Most of the questions that I ask are tick box or choose from the options, so you don't have to write anything in. It makes it really easy for you to go through them and answer the questions. Again, I would ask you the same questions. Can you describe the pain to me? How did it start? What makes it better? What makes it worse? So having all that information already in the notes means that I can prioritize the time I do have with you to understand what you're really worried about. So yeah, we go through the different questions, and depending on your answers, you might have slightly different questions that you have next. So it's really important to answer them as best as you can. And there is always the option of, I'm not sure. Okay. So we keep going through them. And some of these questions are really important, actually, for us to be able to understand whether we need to see you today, or is it something that can work with your diary in the next few days? So again, just information that I would want to know. So you can use this on a phone, you can use it on an iPad, you can use it on a computer. Because you don't have to download any apps, it doesn't matter what mode of access you're using, but you do need to have an email address. Now, I know that some of the questions are going to be, what do I do if I don't have a smartphone or access to the internet? And I will come on to that. Okay. And we will help you through that because we are here for that. Okay. So some general questions as well, just to make sure that we make sure when do you need to be seen? How urgent is this? What are the things that would make me as a GP think, oh, actually, no, I can't make that wait till the weekend because that's not appropriate. Because it does talk to our clinical system, but it doesn't read your medical records. It does ask you to declare if you've got any other medical conditions that you feel would be necessary to know, but it isn't going into your records directly once we press save. Okay. Once you've answered the questions, it filters all those answers through to understand what appointments might be appropriate for you. And that can take a couple of minutes because it's looking throughout the whole system to make sure there are any available appointment that is appropriate for this. So depending on the answers, it might be something that only should be seen today. So you would only be offered today's appointments. We have more than 1 minute appointments, I promise. But then you just click on the one that works for you. It's important just to check it's a telephone call or face-to-face because you've said that you wanted to see us. So we want to be able to offer you that. You click confirm. Okay. And what that does, it books the appointment on the system so somebody else can't have it, but also sends you an email confirming that appointment and you with a link in there if you need to amend it. So you don't need to call us. Thank you, Lois. So you don't need to call us if you need to change the time, you need to cancel it. You can use the same link and change that automatically. Okay, so what isn't changing? So because this is an NHS clinical device, it has to have certain licensing and make sure it's safe to be used in X, Y, and Z scenarios. So this is not yet available for under 16s. So appointment requests for under 16s are still being taken in our usual manner on the telephones. And because I'm hoping that the majority of people on this call today will be using this system, it really does free up the telephone lines so that our reception team can help those who need it, who can't access it online, including the under 16s and some of our elderly or more vulnerable community members who may not have access to the internet or to a smartphone. Again, things like home visits. So if you or a relative are requesting for a home visit, please contact the practice in your usual manner. And that can be via telephone so that we can take that request and we can discuss it as a clinical team and make sure that we can allocate that to one of our staff members to come and see you. We not only do GP appointments, as you well know, we send you messages throughout the year if you've got a long-term condition such as high blood pressure, diabetes, lung problems such as asthma or COPD. Those appointments are still bookable through the links that we send you via text message, or you can contact us and we will book that on the phone with you. Or you can come to the reception team if you need to book a blood test appointment, and we will sort that out for you because we are still here. So the other things that we will be doing as usual are things like NHS health checks, postnatal checks and baby checks will still be booked in the routine manner because they are planned ahead. Okay. So, as I said, what about those patients who aren't online? Please call us. We're still here. the door is still open. Our team are here to help you, and they will help you use the system. They will work with you to answer those questions so that we can book you the most appropriate appointment at the right time with the right person. Okay, so the call might take a little bit longer, but actually those questions are there so that we make sure we get the right person to help you at the right time. Okay, so one of the other questions is sometimes, can I still use the NHS app? Absolutely. So a lot of you are still using it. We've got some really good users of the NHS app compared to a lot of parts of the country. Handsworth Wood and Laurie Pike are doing really well. And I would encourage you, if you've got friends, family who haven't got it yet, please download the NHS app because it really does help you manage your health. You can still do your prescription requests. You can still view your records, your test results. All of that is still available on your patient access and the NHS app. But the appointment booking that some of you have used the NHS app for is now only going to be through our Rapid Health platform. Okay, so that is the end of my slides. And I'm really, thank you so much for your time and engagement. Lois, have we got any questions?
We have lots of really good questions, which is exciting. So,
yeah,
let's go through them all. I'll do the ones I've started from, and I'll go back and have a look in live chat. So if you've got more questions, please answer them. We will try and get through as many as we can. Before actually we start, we do have some Rapid Health frequently asked questions.
Yep.
For those who can get to the website, if you go on there, you can have a read of those as well, just to say that they're there. And actually, from your question today, we might add a few different questions.
Brilliant.
Good. So first question is, what happens when the system goes down? So when the web goes down? It's a good question.
Absolutely. So as with any form of technology, we always have to have what we call a business continuity plan. So if we get a flood, if our phone lines get cut off, if our internet goes down, we always have to have a backup plan. So even with this technology, if, for example, the website goes down, we will contact you. We will make sure that we send a text message out, and our phones will still be open and our doors will still be open. So touch wood, we haven't had full blowout of our internet, but if that, we always have a plan if that happens, but touch wood, we haven't had that happen in many years.
That's great, thank you. So I'm sorry, because people want to see the reception. I think not everyone uses the internet, so I think that's about actually, if you can't get access to the internet and you're not comfortable filling out the form for whatever accessibility reason, absolutely, you can still phone us and the team will fill it out on your behalf, but they will still go through the same questions as that. I don't know if we add to that now.
Absolutely. Yeah, absolutely, Lois. That's so we know that not everybody has the internet, not everybody has a smartphone, not everyone can use the smartphone, even if they have one. And we don't want to disadvantage people. The whole point of the system is to make it fairer. So those of us who can, if we can use the system online, it makes it fairer for those who can't. And therefore, it's not a lottery when you ring up at 8 a.m. who gets the appointment. Everybody has a chance. And that's what's really important. So if you're not able to, please call us and we will help you. And we will go through those questions with you so that we can make sure that you get the appointment at the right time with the right person. And we can give you the right help. And by answering those questions, we really can make sure that happens. So please bear with us. We're not being nosy. We're trying to help. So I hope that answers your question.
That's good. So someone's, if you're joining us, someone's asked about, is this video saved? Can they watch? They missed the first part. Absolutely. So this is saved on YouTube and Facebook. Once we've finished, we can watch it again. And please tell people who've missed it, maybe your family, your friends, your relatives, that they can come and watch it. It's there ready live for you. So don't worry if you've missed the start and you're just joining us. It will be available.
Absolutely.
Again, will this be the only way to book appointments going forward, or can we still use the NHS app? And I think you've just covered that.
Yeah.
So
this is one. Yeah. Sorry. This is the way that we have chosen to book the appointments because it allows us to prioritise and make sure that people get a safe service. Certainly, as a clinician, we have a limited number of appointments that are bookable online at the moment, and so it will I do the evening clinic on a Monday. I'm sure some of you know that. And I will have things that have been booked in from last week because we've received an online request. Actually, I probably would have rung them 3 days ago if I'd known that they needed an appointment, because it hasn't been clinically triaged. So this is safer because we can give you that appointment at the right time and allow you the flexibility so that you don't have to drop things at the last minute and say, no, the doctor needs to see you now because that's the time that they've got. But actually it's working with the time that you've got. And because you're able to see which appointments are available, you can choose the one that works best for you. Some conditions can be dealt with on the telephone, but a lot of conditions need to be seen face to face so that we can examine you. There are things that I will pick up that you're not telling me necessarily, but from my clinical experience, I can read from your body language, from the way that you're walking in, the way that you're holding yourself, that really help me understand how to help you. And so we have those options available so that we can best treat you, so that you can come to see us and it works in your diary and we can give you the best possible care.
That's great. So somebody's asked a question, I think is two ways. Is one is about how you book a routine appointment and also for a review. So a routine appointment, that would be through Rapid Health, but maybe a review that you might be recalled for diabetes or hypertension or something, that would be generally done through your recall system, would it?
Yeah, so I can understand where they're coming from. It's a really, really good question because there are two different types of review as well. So certainly for an initial problem, for example, I would really encourage you to use Rapid Health, answer the questions, book an appointment with a clinician. And sometimes a clinical problem needs a review. So sometimes I'm not sure what's happening, or I need to do some tests and then I need to speak to you in 2 to 3 weeks' time, or I started you on a medication and I need to make sure it's working or you're not getting horrible side effects with it. In certain circumstances where it's appropriate and necessary, that clinician will send you a link to say, well, you can book with me using this link in 3 weeks' time. There are some conditions that might need a little bit longer, say 4 to 6 weeks. If you've tried these exercises or this particular treatment and it hasn't got better, please submit another form. And you can use the rash form or the pain form, and then we can answer that question for you to see how you're getting on. The other type of reviews that we do are the planned care reviews. So if you have a known condition, such as diabetes, heart problems, so high blood pressure, asthma, COPD, all of those long-term conditions that we do an annual review, we will send you the link as before to make sure that you get that annual review and subsequent checkups with the nurses, the HCAs and the GPs to make sure that your ongoing condition is managed and looked after. I hope that answers the questions if you were thinking of reviews in different ways.
That's okay, it's really good. This is, can you book various types of appointments? Sometimes a telephone appointment will suffice. So will there be a choice about face-to-face and telephone appointments?
Sure, that's a really good question. So depending on the problem, then yes, a telephone consultation might be sufficient. I may be old school, and I'm sure my grey hairs are coming out for a reason. I like seeing you. I like talking to you, to your face. I appreciate that's not always possible. Everyone is really, really busy. You're trying to do 101 things. You've got children, parents, all of them to look after, including yourself. So there are certain conditions that a telephone consultation is sufficient, and you will have that option to book. A lot of conditions can be seen face-to-face, should be seen face-to-face. Things like tummy pain, I would want to examine you. I'd want to make sure that you are okay, because that does change what I do next and how I help understand what's going on with you. And so those will be face-to-face appointments, and there may not be a telephone option, particularly if it's urgent. If it's something that is significant pain, temperature, fevers and temperatures and unwell, I need to see you.
Mm-hmm. That's great. So we've answered the question about follow-up, but someone's asked just to add to that about seeing the same GP as before. So are you saying, so if you've seen that GP and then they've asked you again, then they should have booked that, send you a link for you to book that. And then what happens if you've got something ongoing and it's a flare-up? How would you potentially get in with the same doctor?
Sure, that's a really good question. So when you fill in the questions and you go to the booking page that shows you the options of who's available, you can see who is working on the days that are available to your appointment type. Not all of us work every day of the week. And so some conditions need to be seen today or tomorrow, for instance. And if that particular clinician is not working those days, they won't be available for you to book with them. So I would urge you to say, well, actually, if it's clinically urgent and necessary, please book an appointment. We are all here to help. We share the medical records amongst the clinicians and we document so that the next person is able to pick up the next piece of the journey to help you along. It's only in certain conditions where I would send a link saying, oh, actually, you need to speak to me about this. And usually that's a mental health issue because it takes a lot to talk to somebody about what's going on. And to then start again from scratch can be really challenging when you're in times of crisis or really significant sort of mental health issues. So those links are usually reserved for those people who really do need that one-to-one care at that time. Okay, so but all of us are here to help. All of us are trained clinicians who have skills to be able to help you. Please do use the system, book an appointment, and we will help you.
So someone's asked about when they will be notified about when this will go live. So obviously it's going to go live on the 15th of October, and it will the link will go live, I think, the evening before on the website.
Yes.
And then I believe they'll be texting out patients to notify that it's going to go live just before. So the link will be within that text.
Yeah. So there will be links in the text message. When you come to our reception, there will be posters and the links to the website with QR links and all of the stuff that you need to be able to access it. We are aiming for it to go live at 5 p.m. on the Monday, but the true live on the phone will be from Tuesday the 15th. So keep an eye out and have a look on the website, and we are there to look at your submissions, make sure you get the appointments. Everything is ready to go.
Good. So someone says, can I still call at 8 a.m? But I think we've covered. I think that actually you can, if you can't use the internet and you're not comfortable in that way, you can still phone us. But we are encouraging as many people as possible that are comfortable and feel confident to use the internet, because actually it's better when you fill out the form and also frees up the phone lines for people who can't. Yeah.
By all means, you can ring at 8 a.m, but you might not need to.
Yeah.
So you might be able to ring at another time that the phone lines are still available, and that is the whole point of it being open 24 hours a day, is that we understand that people have medical questions throughout the day. We work 8 till 6:30, so anything that you submit out of those hours will be dealt with the next working day. But we understand that most people are at work at 8 a.m. Most people are doing a school run at 8 a.m. Things don't happen just because we open at the same time that you do. And we want to be able to encourage people to ask their medical concerns when they are worried about them. And it might not be that you get an appointment that day, because you might not need an appointment that day. But we want to be able to open that out so that access challenge that we talked about right at the beginning becomes less of an issue, and you actually get the care that when you do see us, you know you get good care. And we want you to be able to get that when you need it.
So there's a good question here about data. Who else other than modality GP surgeries have access to the data?
So the data, so all the information about governance and privacy, we will put a note on the website. The data is only saved in your medical record, so you have access to it, as does your clinical service, so us, your GPs. The hospital, if you have accepted shared care records, and sometimes if you've done a referral to them, then we will attach the appropriate information to the hospital as part of your referral so they can understand why you need to see them for your rash, your joint problem, and that might be part of the consult that you've spoken to us about. Yeah.
Okay. So what about, there's a couple of questions about if you have an elderly relative or somebody who's got difficulty in accessing, can you fill the form out with them on their behalf?
Brilliant. That's such an important question. Yes, absolutely, you can fill them in on their behalf, provided they are 16 and over. The most important thing is the email address. And so if your family member is happy for you to put your email address on their record, we can save that on there, and then you can access it on their behalf, provided you put in their name and their date of birth and their postcode. Then the form that you complete will be saved to their record, not you. Okay.
Great. And what is the timescale for a non-urgent routine appointment? In other words, what's the longest time you will have to wait to be seen?
So we've said 5 working days.
Okay,
yeah. So if it's not appropriate for an appointment, it will come into the inbox for the duty GP to look at. And we have said that we will try and get that reply to you within 48 hours. Obviously, we have to take into consideration weekends, but we will get to you within 48 hours. Okay.
The question here just about a reassurance about services that are still available, still be the same, and that's about 111. And 111 will still be available, exactly the same service.
Yep.
But hopefully the access in primary care will be better, so not as many people will want to call 111. That would be the aim. Someone's asked, did we consult with patients before we've made this decision to make this change? There's a couple of people that have asked that.
Okay. So we looked at the patient feedback that we had got. We had spoken to other of our divisions about what people had been looking for and what they were finding frustrating. We spoke to patients at our sites about what the challenges they were having, and we took that information to find out what would suit best as a solution for all those questions, if that makes sense.
Yeah, that's great. So there's a question about people whose language isn't English, isn't their first language. What's in the system, and how's it going to work for somebody like that?
So absolutely, if you can do that on somebody's behalf if you are helping them, if English is not their first language. As we said before, you can do it on their behalf and use your email address. If you are able to complete the form on a web browser using Google Translate, that is an option. If you're not able to use it, we are still here. We use Language Line to help us translate for other languages with our reception team, and we will help answer the questions for you to get you an appointment that you need. We are still here. Our reception team are still here. They are still at the desk. They are still on the phones. So they will be here to help you, to help navigate you to where you need to go for the website. If you don't have the link already, if you need assistance with languages, we are here. Okay, great.
There's a question about fit notes for work. How would you navigate this website or Rapid Health to get a fit note?
So certainly there is alongside on the first page, there is medical request, there's admin request, and there's self-help. So on the middle one, the admin request, you can request a fit note, or you can request medication, you can request a question to reception team. So that is how you can get a fit note. If it is a new fit note, we would want to speak with you to understand what's going on and how best we can help you as well.
That's great. Someone's asked about what website access is. So it's actually on the practice website pages. And if you don't know what that website address is, because I can't quote it off the top, you can literally put in Google Handsworth Wood and Laurie Pike medical practice, and you'll be able to find it. But there's a lot of information around the practice.
So it is handsworthwoodmedicalcentre.co.uk.
There we go.
So it is very easy.
And Laurie Pike?
I think Laurie Pike is lauriepikehealthcentre.co.uk. We tried to make it as easy as possible. Previously, they were quite long-winded URLs with www.modality.something/, and I can't remember the website. So it was not helpful. But it does come up on Google. And if anybody doesn't know the website, we will have business cards. We will have links all over the practice. We will text you with the link to the website so that you have it there ready to and to use. Yeah,
that's really useful. And I found also when I've spoken to people elsewhere is to bookmark that in your phone or on your laptop or your tablet or whatever you use online, and then you can get straight to it. So this is a question I think really about the form doesn't allow for free text. So someone sort of asked, well, how can you exactly explain what's particularly wrong with you? And it's just explaining why it's in that way.
Okay, so absolutely, the questions are designed to give us an idea of how urgently we need to see you. Or is there somebody else who might just see you better about this? If I can give you an example, a patient came to see me on a Tuesday morning. It was a face-to-face appointment. They had an eye problem. We have a minor eye condition service who are fantastic and better than doctors at looking at eyes, because they have all the fancy equipment to look at the pressures, to look at the back of the eye, to make sure you are safe. And unfortunately, I had to say to this person who came to see me, is like, you don't need me. You need the eye team. And she was incredibly frustrated. And I could understand why, because she had wasted her time to come and see me. And I'm telling her that she needs to go and see someone else. This is a system that allows us to be able to do that before we wasted your time. The reason the questions are simple and quick is that actually what you're really worried about, what you want to tell me, I'm still here to do that bit. I'm still here to understand the rest of the context of the problem, to understand why you're worried about it, to understand what your family history is, to be able to put it into the next steps to work out what's wrong and what do we need to do next. So it doesn't replace the doctor, it just gives us a hand to understand what we need to see, when we need to see it, and how we need to see it. I hope that answers your question about why the questions aren't free text. I want you to talk to me.
Okay. So there's about how far ahead of the appointment's allocated, can we choose an earlier appointment that may be than may be recommended?
Yes. So for example, you've got a problem that needs seeing, but it's not a today, absolutely, I'm worried about you, do I need to send you into the hospital problem. You will be offered appointments up to 5 days, not just day 5. If that makes sense. So you might be able to be seen today about it, but you might also be offered the appointment for next Tuesday. Somebody else might submit a problem and they've got a raging temperature, they're really poorly, they're finding it a bit hard to breathe because of their cough. They're not going to be offered an appointment on Tuesday. They're only going to be offered any appointment that's available today. So that's how it works, and that's why those questions are really important, so that I can see definitely the thing that needs to be seen today. And, if the person wants to come in today for the thing that could have waited, well, we're here too, because we want that flexibility.
That's good. So we've asked someone to send a comment about being able to read the slides. So I think we may be able to share those in some way afterwards if they weren't able to read it on the video.
Sure.
A couple of questions about children and booking appointments with children. So let's probably go over again about how that's going to work.
Yeah, I appreciate sometimes I speak really quickly and I get very enthusiastic and then I speak even quicker. So let me just clarify again. Because it's an NHS digital device, it has certain licensing and things that allow it to be used in certain situations. It's not licensed yet to be used in under 16s. So 16s and over can use the system with their parents or on their own. With under 16s, they can't use the questions, but our reception team are still here. Please phone the questions. They will ask some simple questions so that we can understand if we need to see you today, if it needs to be a telephone or a face-to-face appointment, is there another service that might be able to help you? Okay.
That's good. There's questions about, and I think this is about Ahed app, but it applies to patient access, and it's just any of those other sort of apps, and will people still be able to order their repeat prescriptions and access in that way?
Yeah, so you can still request your repeat medications through the NHS app or Ahed. You can't book appointments. The appointments will only be through this website-based link.
But you can use it on your phone and tablet, can't you? Yeah.
Oh, yeah, absolutely. Yeah. Your phone, your tablet, internet on your big desktop computer if you've got one still.
So at the moment, it's not available through any sort of app, but I do know from Rapid Health that the plan is that it will be embedded into the NHS app going forward. But at the moment, it's web-based. Yeah, so it will eventually be integrated into the NHS app. It just has not happened just yet. So nothing else to download. There's a question here about if using this, and because we're all lots of modality sites we all work together.
Yeah.
Does that mean you'll be able to go to one of the other practices if there's no space or a more convenient to location to you?
So that's a really good question.
Yeah.
In theory, yes, and some of us have worked on different sites. So I know that I have done shifts at Laurie Pike and Enki when they've been really short. In theory, yes. We kind of want to look after who we know. So I would encourage you to please book your appointments with your surgery. I certainly think if that's something that you are interested in, please let us know if you're interested in wanting to travel to other sites. We've always felt that people sometimes are happy to go a little bit out of their way, but not necessarily to the other side of town, because that sounds challenging and a different form of access issues. So we would like to look after you because we know you. But certainly if it's an issue that certainly in the future, that might be something that we can really consider to help cover, if there's sickness or staff shortages. Yeah, that's a really clever idea.
Or also, some people may work in a different part of area, and actually the other site might be closer to their work, and there's those kind of things. So maybe in the future we can look at that.
Certainly.
Yeah. So someone's also asked about booking through System Online if you have access to the internet and smartphone. So System Online will still be available for all those functions like repeat prescriptions, but booking appointments will only be through the Rapid Health system. This is a really good one. How will we be able to report glitches in the system? So feeding if there's any kind of problems.
So certainly please contact the practice. So you can, even on our website, there is to contact us, you can fill in a form. And please, if there are glitches that are happening, then we want to know about it so that we can fix it. Yeah, absolutely.
Another question again, just to reiterate, you can still call the practice if you're unable to fill it out online, and said, or is it not allowed? No, it's definitely allowed. If you're unable to use the internet or you're struggling, please do call us.
We know that, we know that this is not going to be for everyone, and we know that we have. I've worked in nearly 8 years. This is not the easiest place to live. People are really struggling and life is not getting easier. We don't want to make things harder for people. We want to make it easier for those who can so that we can help those who can't. Mm-hmm. So if you are able to access it online, I really do encourage you to use the platform that's there. And that allows other people who don't have the same access that we do to be able to, for us to help them. So we will help them on the phone. If they come to the surgery, we will answer those questions with them. We will help you, but we need your help as well to be able to make that happen. We've got a limited number of people. We're trying our absolute best. And sometimes that's not good enough, which is why we thought of something else. And if you remember the telephone data, if we can even half the number of people who are ringing in to book an appointment, imagine how many people we could actually help who need us on the phone or need us face to face. Enki and Bellevue Medical Centre have been using it for the last fortnight. Their queues on the phone have really dropped because they're now able to focus on those people who need them on the phone and can't use any other access. So yeah, we have to work as a team here to help each other, not just us. It's helping our fellow people.
That's great. So there's a couple of comments about I can't find the link yet. Well, it's not live yet, is it? So when does it go live?
Yeah, we wanted to tell you about it in advance, and we will go live, but that's happening on the 15th of October. So it gives you a little bit of time to watch back the video if you want, to have a look online for other questions, and we will go live next week.
So there's a few questions around, are there still going to be 8 p.m. previous night appointments? And another one, which is, do I need to book an appointment at a certain time, say by 7 a.m. on the same day?
No. So certainly, if you were to fill in an urgent thing that needs to be seen, and you do that at 6 p.m., you will be offered the appointments for tomorrow morning because we've only got 20 minutes left to see you. So certainly from that perspective, but we will be working up until 6:30 trying to get through as much as possible. The 8 p.m. from the night before, this replaces that. So you don't need to go on to the NHS app or look to see where the appointments are. It's just through the link. You can use it any time of day. And depending on the questions that you answer and the clinical concerns, it will offer you an appropriate appointment.
That's great. So a good question is, will this be reviewed at some point to ensure it's working? So further on, once you've implemented it, are we going to check and review and see what else we could do to improve it?
Absolutely. So just going back to the person who'd asked about glitches, that's why I need to know about them. We need to know if you're having issues or there are concerns, and we will be reviewing it on a week by week basis to make sure that it's living up to what we wanted it to. As far as I have been able to see for the last 2 weeks with Enki Medical Centre and Bellevue, it's working really well. So that's really encouraging. And I'm really excited because it means that I can actually do the job that I'm here to do, which is help people and answer their medical questions, and not just say, I'm really sorry you weren't able to get an appointment, because that's really frustrating. So, we want to know about it. We want to know about issues. We want the feedback so that we can make sure that we make it work.
So I think we probably will be sending out some surveys to patients, won't we, to collect that kind of feedback. There's some questions about, there's obviously a fear because obviously everyone struggled to get an appointment previously. How many appointments will be available? You know, will there be enough appointments?
Yeah, so we were worried about that too. We were worried that everybody is going to jump in all at once to book their appointments. And so far, looking at the experiences that the other two sites have gotten through, we have got the capacity. I think it's a really interesting, how do I put it? It's a really interesting perspective to see actually what questions people are asking. They're really important, they're really appropriate. And actually with some of the information, I'm able to say, well, this could be dealt with by the pharmacy. So we're going to please go to the pharmacy about this, and then we will review if it hasn't got better. Please go and see the eye condition team, because actually that would save an appointment for somebody else who needed to see a GP, and you get the care that you need from the right person. So we have got appointments. We do need to be smart with what we're doing, but that relies on our patients also asking us the right questions and answering the questions in the right way so that we can give you that help.
That's great, thank you. So there's a question about the balance of face-to-face to telephone. I rarely get a face-to-face appointment. Will there be more face-to-face? And it specifically say about Laurie Pike, but any of the practices will be more face-to-face.
So we have tried to listen to that feedback that we've had, that you want to see us, we want to see you. So some of the conditions have a face-to-face option and a telephone call option. So if it is appropriate, you can book a face-to-face appointment and those times will be given. There's very few conditions, in my opinion, that can only be dealt with on a phone, but we have got a few that allow people to book a telephone consultation so that they have that flexibility. But most of them will be face-to-face.
That's great. So good question about the technology behind it. Is the triage thing a doctor or a computer? And there's a bit of questions around that. Is that, how can it work if it's not a doctor looking at it and triaging it?
So it is AI supported, and that is where the information has come from, for it to allow that, for those questions, why those questions are so specific, to be able to help sort of risk manage and assess when that person needs to be seen by what date. And we have set the time limit to being 5 days because we felt that was safe enough for us to understand if it was a non-urgent problem. I don't want to wait 2 weeks. I would like to see it within 5 days. There is a GP on site every day for all those medical requests that haven't been booked as an appointment directly, for us to actually manually make sure that that person either gets an appointment, information, or signposted to the right service.
That's great. So there's a question about how you access it, and if some people have joined slightly later, hello everybody, but they're asking about, will username and password carry over to the new platform? So the good news about this platform is you don't need a username and password. So what do you need to be able to identify you?
Yeah, good question. So no app, they don't need to download anything. You don't need a username and a login. What you do need is your first name and your surname, exactly how it is registered with your GP, your date of birth, and your postcode. In your record with us, we need to have an email address. When you fill in the form, you need to add an email address and a telephone number that we can best contact you on. Okay, name, surname, date of birth, postcode, valid email, telephone number.
Brilliant, that's great. So another question about, just to reiterate again, if you use any other thing like System Online or NHS app or Voice Connect over the phone to audio repeat prescriptions, that still stays exactly the same.
Yeah.
And someone's asking about non-appointment queries, e.g. about getting a whooping cough vaccine for a pregnant lady.
Okay.
That would be the best way to do that through you.
So if you've got a non-medical request, so you're not asking for an appointment, it's a question about injections, referrals, fit notes. There is an option that says admin request, and so you can choose the one that's most suits your issue. And there is about 11 different types of travel appointment type. There's one requesting information. There's one requesting results. All of that. Complete the task, it comes into the inbox and we make sure one of our team members contacts you with the right information. So if, for example, it's a whooping cough, we will assign that to one of our reception team to call you and book you in with one of the nurses or HCAs for your injection.
Brilliant. That's good.
It just helps us streamline all the bits and pieces that are coming in so that we can answer your questions.
So there's a good question about how long after, so for instance, if I'm not offered an auto-booked appointment and choose it online myself or over the phone with the receptionist and it goes for review with the GP, how long does it take before I'm contacted?
So we really try and do it same day, but we've said up to 48 hours, just in case technical glitch, patient is really poorly and that doctor is busy looking after them and they haven't had time to go through the inbox. But it is the next working day. But we try and do everything the same day.
Right, I'm going to try and squeeze in these last 6 questions.
Okay. Yeah, we've got 4 minutes. Otherwise I'm going to get locked in the building.
So this is a really good one. I don't think we've answered. What happens if you want to ask or a query about a condition, more than one condition, more than one thing to doctor about?
Yeah, absolutely. Really, really good question. Fill in another form. So as a GP, and I know we really try, it's really hard to do more than one thing well in 10 minutes. Sometimes it's possible. Sometimes that's when we get the feedback that you seemed really rushed. And it's because we've got a waiting room full of people waiting for their next 10 minutes. So actually, if you've got more than one problem, fill in more than one form because that other problem might need something different. It might need a referral to another agency. So sometimes it's a pharmacist, sometimes it's an eye service, it's dental. All of those people exist as well. Sometimes it might be something that needs to be seen today, but the other issue could be seen in day 5. So please do fill in another form. And so that the questions that you answer are for each concern that you have. And it might be that you have 3 appointments, but you might not need those appointments ever again. So at least we've done the ones that you're worried about.
Brilliant. Someone's asked a question about, would you consider doing video calls so that patients can physically see their doctor? Because sometimes that is nice for patients too, especially if you can't physically do a face-to-face.
That's a really, really good suggestion. I have done video calls with patients, usually when they're not able to visit me because they're housebound, and we're able to do at least a conversation with eye contact, and it works really well. Yes, we could do that. Absolutely. We do have a facility. Most of our computers have got webcams. We do have a platform that we can do it from that doesn't require us giving out mobile phones and things like that. Yes, that is an option. Sometimes I appreciate I am ringing you and you are doing something else because you are busy people. So I don't want to do a video call necessarily if you're on the bus.
I've got a question about where we can find the form, and I'm going to put something in the chat about that and put the website addresses.
Sure. Thank you.
About cancel or rescheduling appointment, how do you do that if you booked it?
So when you get that email that confirms your appointment that you've booked, there is a link in the email that says if you need to amend or cancel this appointment, click here. So it's so much easier than trying to ring up, be in a queue, wait 2 hours, your appointment has gone, and you're still waiting to say, I can't come, by which point the doctor has usually marked, you did not attend your appointment, and it's all very frustrating for everyone involved. So we've used something that allows you to have more control over your appointment so that it can be used by somebody else if needed.
That's great. So last couple of questions before we have to end. What about urgent children's appointments?
So children appointments can't be used through through Rapid Health. It's only for over 16s. So please call us. If it is truly urgent and you're worried about your child, please either ring 111 or 999.
That's great. And we've covered this a bit before, but in terms of follow-up appointments, either the GP you're seeing will actually book that follow-up for you or send you a link to be able to book it later. Or if it's something they say, see how you are in 4 weeks, then recontact and go through the Rapid Health form. And the very last question, I'm sorry if I haven't answered your question, but it's been amazing. Thank you so much for all the questions.
It's been brilliant.
How can you choose the doctor you like? How can they choose to come and see you?
So when you go through the form and you are offered the appointment, it will show you which clinicians are available depending on the concern that you have raised and how appropriate it is. So if it's something that can wait till the day that I'm working, it will offer you my appointment or my colleagues or whoever you wanted to see. If it is not available because you need to be seen within X amount of time, please do book the appointment that you're offered so that we can help you.
That's brilliant. And thank you for everybody's questions. It's been so useful, and actually it's added to us thinking actually we should probably include some more information in the frequently asked questions. Some people are saying thank you, and that's brilliant. Thanks for that. And some are still a little bit worried, but we want to provide assurance that actually we were there for you. So if you're struggling with the system in any way and you're not finding it easy online, please phone us. But if you can do it online, please do that. So it's free phone lines for those.
Absolutely.
Is there anything else you want to finish with, Naz, before we close?
I just wanted to say a huge thank you to all of you who've watched today, given the feedback, given really interesting and important questions for us to think about and suggestions about what we can do better. If you guys really do want to get involved, please contact the practice that you're registered at, and we can form a group for patients to be able to give that feedback in a more formal way, and have your feedback on a monthly or 3 monthly basis, whatever. But honestly, I'm so excited for it to go live next week, especially where I work at Handsworth Wood. Thank you so much for your attention this evening. I really appreciate it. And thank you, Lois.
Yeah, thank you for joining us, and thank you, Naz. Just to remind you that actually if you come in partway through, you can watch this again. It's going to be on our Facebook page on the video section or on the feed, and also on YouTube Live on Modality Partnership. You go to Modality Partnership on the live section on our channel, you will see there's lots of videos, which we've done this a few times, but please do watch again, and please spread the word that the change, and we look forward to it going live on the 15th. Thank you so much, and see you later. Bye.
Good evening. Bye.